Good morning, everyone. Today I'll be talking about the syndromes affecting the sciatic and the femoral nerves. Next, please. Before we talk about the syndrome, I want us to know what is called a sciatic nerve. What do we call a sciatic nerve? Where is it located, and what is its function? A sciatic nerve is the largest nerve in the human body, and it's formed by a union of 5 nerves roots. From the lower spine, it passes deep in the buttocks and down the back of the thigh, all the way to the heel and sole of the foot. The sciatic nerve serves a vital role in connecting the spinal cord with the skin and the muscles of the thigh, leg, and the foot. As we can all see, this is on the image here. This is the sciatic nerve, and it's the largest, it's like a thumb. The nerve, it's like a human thumb. So next, please. Now we are going to talk about the syndromes of sciatic nerve. What happens if anything happens to this nerve? What are those things that can cause damage to these nerves, and how do they happen? The first one we have is sciatica. Sciatica refers to pain caused by the sciatic nerve that carries messages from the brain down to the spinal cord to the legs. The pain of sciatica typically radiates down one side from the lower back into the leg, often below the nail. The most common cause is a booging, that is the herniated discs in the lower back. Discs are tide-like structure that sits between the bones of the spinal cord. They stand like a cushion for spinal cord, so that there won't be friction there. If the outer rim of the disc tear, usually due to routine pressure on the lower back, the jelly-like inner material can come out and pinch or inflame the nearby nerve, which is the sciatic nerve. Then we have the second one. What are those things? Now we are going to talk about the type of the type of causes, the type of the disc that happens to be the one that actually causes sciatica. The first one, we have the foraminal stenosis. Stenosis, or narrowing of the intervertebral opening through which the sciatica nerves root travel, may compress or irritate the sciatica nerves. Other degeneration changes in the spine, such as tickling or fatigue joints, capsules, or ligaments, may also directly compress the sciatica nerves. We have the segmental instability. Instability of a vertebral segment that occurs in one vertebra slip over the one below it, and that is called this spondylolisthesis. Vertebral defect or complete dislocation of one or more vertebra may directly compress the nerve roots of the sciatic nerve. This place is trying to tell us that if there is a dislocation, or if the disc compresses, or there is any defect in the vertebral column, it can actually compress it's not the nerve itself, it's the branches, because the nerves branches from the third lumbar region to the fifth lumbar region. All the nerves there comes together to form these sciatic nerves. So if anything happens to that region also, it can affect the sciatic nerve itself, and it can cause sciatica. The second one, okay, we have a note here. It says rarely tumor, cyst, infection, trauma, or abscess in the lower spine or pelvic region may compress the sciatic nerve. We have injury. Sciatic nerve injury may occur between 0.5% and 2.0% of the time during hip replacement. Sciatic nerve palsy is a complication of total hip arthroplasty with an incidence of 0.2% to 2.8% of the time, and with an incidence of 1.7% to 7.6% following revision. Then we have anesthetic. Anesthetic is given to block the pain signal from going down there. So if they want to do any surgery that has to do with the pelvic region or the thigh, then they have to block the nerve in order not to transfer, to interrupt the transmission of pain signal. Next, please. Here we have the diagram. We can see the diagram of the sciatica, and we can see where the pain is starting, where the nerves is, and where the pain, the area where the person will be feeling the pain. We have at the thigh, lower, just below the nail, and on the heels, the patient is going to feel the pain there. And we also have the diagram of spondylolisthesis here also. Next slide, please. There is another syndrome called the Peripheral syndrome. It's an unknown muscular syndrome that is caused when the piriformis muscle compresses the sciatic nerve. The piriformis muscle is a flat band-like muscle located in the buttock near the top of the hip joint. The muscle is important to the lower body movement because it stabilizes the hip joint and lifts and rotates the thigh away from the body. This enables us to walk, shift our weight from one foot to another, and maintain balance. It is also used in sports that involve lifting, rotating the thigh in almost every motion of the hip and thigh. Piriformis syndrome usually starts with pain, tingling, or numbness in the buttock. We can see where the muscle is, and we can see where the pain is. Next, please. Now we're going to talk about the femoral nerve, well, where it's located and what they do to the body. On the picture, the lower picture here, we can see how the connection comes to form the femoral nerve, and we see where the femoral nerve is. The femoral nerve is the main nerve of the anterior compartment of thigh. It originates from the dorsal section of the anterior primary ramen of L2 to L4 nerve, and is the largest branch of the lumbar plexus. The nerve descends from the lumbar plexus in the abdomen, traveling down through the fibers of psoas major. The nerve exists psoas major at the lower part of its lateral border, passing behind the iliac fossa to approximately a midpoint of the inguinal ligaments. It then transverses below the inguinal ligaments of about 4 centimeters into the thigh and splits into an anterior and posterior division. The lateral circumflex femoral artery is started by both sections. The nerve enters the femoral triangle by passing beneath the inguinal ligament just lateral to the femoral artery. Next, please. Now we are going to talk about the syndromes that can affect the syndrome of the femoral nerve. The first one, we have injury. Injury it's not really common, but it can be gunshot, it can be a stab, it can be caused by the pelvic fraction. And during this process, the femoral nerve can get damaged during this process. Then the next one, we have the femoral nerve neuropathy. This occurs when the femoral nerve is compressed, where anytime it passes through the inguinal ligaments, when it compresses in that process, then there can be another syndrome of femoral nerve. The third one is the myalgia parastatica, which is also known as MP. This is caused when the nerve cutaneous femoral lateralis, it's damaged, and the main symptoms of this is burning. The patient start feeling burn, they start feeling numbness, they won't be able to climb the stairs. The number 4 is the femoral nerve palsy. This is developed. It actually happens in baby when they put a hardness on their feet, but it's not permanent. It's a temporary thing that when they remove it, the babies and shift it to the other side, then what's it called? It decreases the compression on the nerve there. The fifth one is femoral nerve blocking, also like that of the sciatic nerve blocking. It's mostly used for surgery when they want to do anything on the thigh, and for them to interrupt the transmission of pain signal to the brain, they inject the nerve so as to interrupt the signal of pain to the brain. Next, please. Yeah, here we can see the diagram of the affected area where the nerve is being affected and where the patient is feeling the pain. And for the first slide, we can see how the nerve is being trapped under the inguinal ligaments. We can see how the nerve is being trapped. Thank you.